Hello, everyone. Good morning, good afternoon, good evening, wherever you are around the world. Good to see you, Kabir. I was hoping I didn't have to send another quick note there. But so good to see everybody, and thanks for joining this great session, State of the Evidence for Measuring Health System Interrelationships and Estimating Impact of Health System Strengthening. We have a great panel, a great group of discussants ready to go this bright and early morning on the East Coast. We're hoping that you all came ready with your learning caps on, your M&E caps on, and ready to discuss and join and contribute to what we have to do here. It is a great time to, I was going to say it's a great time to be alive, but yes, it is, but it's also an awesome time. We're hoping that you get the best out of this discussion. So real quick, I just wanted to run through some quick WebEx instructions. If you are not yet connected to audio, feel free to use your computer audio or the WebEx Call Me feature. In the course of the discussion today, all 75 minutes, use the chat panel to submit questions or to just chime in on what you're hearing. If you want to give us a thumbs up when you hear something interesting, please feel free to do that. We like to we like to see that. But also use the drop down menu to send your question or comment directly to the panelists. So when you want to go into the chat, you can use the drop down menu there in the chat to indicate whether this question is to everyone, if you want everyone to see it, or just to those on the panel or the discussants. Another thing is for language purposes and for any other type of accommodations, live captioning is available. So to view or to hide those captions, click the close caption button on the lower left hand side of your screen, and then that would be activated for you, or you could switch it off at any time if you think it's okay without it. Final note that we will be recording this webinar for those many people that uh, um, RSVP, but somehow couldn't make it. We want everyone else to participate as well. So thank you so much again for joining. I'm just going to move on to share the quick agenda we have for today. We do have a couple of panelists from different organizations, the WHO, USAID, the project, and USAID in the field in Washington, and the Alliance as well. But we just wanted to make sure that we all know each other. So if you want to, please feel free to type in your name and your affiliations in the chat. That's kind of helpful for us to know who is joining us. But at the same time, if you're going to be typing in a question, feel free to also remind us who you are, what your affiliations at the time as well. That would help us. We currently have about 91 attendees and many more we know will join us. So we would run through a very quick introduction or an overview of USAID's health system strengthening learning agenda and this evidence gap map for which we're going to be doing a deep dive today. We will do a very short quick demo just so that we can see how the gap map tool works. And then we would show some of the synthesis on this learning question 3 that we're getting to deep dive today, and then do a quick poll because we want to interact with you. We want to get your thoughts about some of the high-level findings we have and some of the gaps in the literature that we have identified from this work. And then we will get into a moderated roundtable discussion. Like I told you all, we have great group crop of brains that are gathered here today. And then after that, we would open it up for Q&A. We have a healthy length of time reserved for interactions with you. So please, you don't want to multitask during that session. And then finally, we close out the session after about 70 minutes from now. So thank you all so much again for joining. I'm gonna hand it off real quick. To Rachel Marcus from the Office of Health System in USAID, and she's going to walk us through some of health system strengthening at USAID and all the great good things that they're doing there. Over to you, Rachel.
Well, happy to be here this morning or this afternoon or this evening. We have folks from all over the world. Part of what I'm going to do is talk a little bit about our health systems work in general, but also really about the evidence gap map work, which was the genesis for the webinar today and the particular topic that we are exploring. And happy to have all of you on the line to help us do that. So as I think many folks know, but worth reiterating, When we talk about health system strengthening at USAID, we are talking about the strategies and responses and activities that are designed to sustainably improve country health performance, country health system performance. And the health systems programs that we work on are designed to support countries to strengthen health systems functions across multiple sectors and health topics and disease areas and public health threats. So by linking traditionally separated areas of health through integrated approaches, it's one way to contribute to the development of more sustainable and more cost-effective programs with lasting and greater impact on both the health system and ultimately on the health outcomes. And so we invest in this kind of health system strengthening because strong health systems underpin all of our other health investments, as everyone here is likely already a champion for, and leads to greater resilience, greater system resilience, and global health security, and is really a necessary foundation for all people to achieve equitable access to quality healthcare. So that means we are working in areas such as strengthening health system strengthening for primary healthcare and global health security. Strong primary healthcare systems are the foundation, right, that pave the way for countries to begin to build health systems, healthy families and stable communities, and to safeguard national security as a first line of defense against public health threats. We also take a strong focus on how do we advance localization and locally centered development and local leadership within our programming. You'll actually see that across other key questions in our health system strengthening learning agenda, which we'll get to in a minute, as well as supporting global leadership and improved coordination and collaboration across so many of you who are on the line today. And we're so grateful to do this work in partnership with all of you. And last but not least, strengthening metrics and analytics for health system strengthening and strengthening health system strengthening learning in many other ways. And so that's what we're going to actually dive into a bit today. If you can go to the next slide. You'll see on the next slide a graphic. There's a lot of text here. I won't go into it all from our vision for health system strengthening 2030. Part of this graphic articulates some integrated approaches in more detail. And the one that's highlighted in red is around the importance of learning and adaptation, particularly the importance of learning and adaptation throughout the process of strengthening health systems from an adaptive management and a continuous improvement approach, as well as, again, strengthening more rigorous monitoring and evaluation and research and learning metrics and data throughout our work. So that is a key kind of fundamental component of the ongoing work currently of the agency. And part of how we operationalize that, if you go to the next slide, please, is around the HSS 2030 Associated Learning Agenda. This is part of the vision. It's also a supplementary document. When I'm done speaking, because I'm not good at multitasking, I'll drop the link also to this in the chat. I think many folks have seen this by now. We've launched over a year ago, but the goal of the learning agenda is to aim to strengthen the global HSS evidence base and improve HSS programming by updating or generating and synthesizing and really disseminating evidence related to key areas of practice. So I would heavy focus not just on the synthesis component, but also on the utilization component, which is part of what we're doing here today. And it's organized by 6 learning questions, which we'll run through briefly in a minute. And the evidence is used on our end to inform our own design and management and evaluation of our work in health system strengthening. We also hope it will continue to inform many of you. And really broadly, the learning agenda has served as a collaborative function, as a collaborative platform to bring everyone together on key topics and continue to facilitate relevant knowledge sharing and knowledge exchange for continuous learning and adaptation. So next slide, please. The next slide covers 2 pieces. So you'll see here kind of summarized versions of the 6 questions. They're much longer than this. These are kind of the catchphrases that we use to encapsulate them. But the questions roughly cover, there's a question on the relevancy and value out of systems thinking approaches, questions on planning for and sustaining sustainability and scale, the question that we're talking about today around health system strengthening and measurement, localization and really centering, again, those local actors and whole of society engagement in our programming, as well as the intersection of social and behavior change behavioral centered approaches within our health system strengthening work. So these are big topics, these are big umbrella goals and questions, and they have emerged from what was an extensive consultation with the broader HSS community almost over the course of more than a year. So we are happy to be working towards contributing, although I don't think I should say answering, some of these questions. And part of how we've done that is by our partnership with the LHSS project in developing these evidence gap maps, which you'll hear a lot more about from Epinyang in a minute. The point of the evidence gap maps is to provide a visual tool that can really synthesize and encapsulate and make accessible a snapshot of the state of the art for all these questions. So where are we? What do we know now? And then really where are some of those gaps? And where the team has worked through 4 of the questions, as you can see here, questions 1, 2, 3, and 5, and are now working on 4 and 6. And if you go to the next slide, you'll see that question 3 here's the full question. And this is the one we're diving into today. What measurement tools, approaches, and data sources from HSS or other fields are most helpful in understanding the interrelationships and interactions within and across the health system and estimating impact of the HSS interventions on health systems outcomes, so system level outcomes, and priority health outcomes. And this is something, there's a lot of text behind this in the learning agenda, but the reason I think that this question really bubbled to the top, and the reason there's so many folks on the line today and why this is always such a hot topic every time we do a session on something related to this, is because we really can see, obviously, from the evidence that there are measurement tools and approaches that we can use to improve our work, but we really need to better understand the relationships and the interactions amongst the factors relevant to health system strengthening, and to really use that to inform our program planning and design and management. Health system strengthening interventions obviously are often somewhat distal, not immediately easy to connect to the achievement of broader country or global health goals. And so that is ongoing work that many folks on the line I know have tackled and are tackling, about how we better unpack those connections, and also how we understand the opportunity cost for not integrating and utilizing health system strengthening measurement in our work. So there's lots of potential kind of sub-questions and areas of exploration here. And if you'll go to my last slide, please, then what you'll see in the evidence gap map, which we'll share around again and which Epinyang will talk through, is that it is kind of where we are on this topic. So the gap map is publicly available, it's free to use, and it takes a range of relevant and timely literature, looking at literature from the last 6 or so years in both the peer-reviewed literature as well as practitioner documentation and gray literature, focused primarily on articles from LMICs. And there's many ways on the map to sort the evidence by different themes and by different categories, and to kind of dig in to what's been found. And what we hope is that this is in and of itself useful for everyone to utilize what evidence exists in our programming. That's certainly part of how we're using it, but also to highlight where there are gaps. And then that is something that we hope to talk more about today as we think through what those gaps are and what more is needed and where we should prioritize our work going forward under this particular learning question. And so I think what we're doing next is going to walk you through a little bit more of the gap map, and then we'll move into our technical conversation. And Epinyang, I'll hand it back over to you. Thanks so much.
Thank you so much, Rachel. Appreciate that. So this is the gap map, and I think we would have the link on the chat in a couple seconds, but we access it through the LHSS website. Thanks, Cara, for posting it on the chat. So feel free to click on the link in the chat, and we're going to play with it as I go along. But one of the things I wanted to do here is a very short demo in the time that we have. But before we do that, I just wanted to remind us all that the process of getting this evidence together, we had 4 major steps where we tailored search terms and pulled information from wherever we could find them. And then we had abstract and full article, full text screens of all of them, and group them into the various sort and search functions, preset functions that we have, if you would notice on the chat, and then in the link. And then we validated them, we tagged and categorized them, and we uploaded the content. It feels like summarizing to these 4 steps, but it took some time to pull pull this off, and we're kind of proud of what it looks like, and we still making improvements to the site so that it meets all your needs. This is how it looks like. There are kind of three to four major steps in accessing this information. So you find out that it's pretty easy. Once you get to the link, you will pick the learning question you want at the top, and then you would hit find search, and then you would have filters. So there are filters that you could filter the results from. So when you see, you could filter by I'll show you the different parameters you can filter by, but once you get your results, you can then click on whatever you need to see, based on the headers or the rows and the columns. And so this is an example. We pick a question here, like I was saying, in this case, systems thinking, and then these are the results that pop up. But because I have 179 records and I want to still filter them by what I'm really looking for, I can hit the filter button over here, and then it pops up on the left. I select what I need: health outcomes, country, date range, whatever part of the world, whatever health system function I'm thinking about. If I'm working on service delivery or HRH, I just select the things that I need there, and then now it's narrowed it down to just 18 records, and then I can look specifically at what I have. Now you would notice there's a matrix here, and the color scheme kind of indicates the relative number of records compared to the others. And so you pick what you need, and then it pops up in another screen, so that you could still have your search results obvious at the back. So it pops up another screen, and you can go through each article or each resource and see where they are. So that's just a little quick overview of how it works. In addition to the tool, we did a very high level quick synthesis two-pager document to kind of characterize the evidence that we have found, so that it's a little bit easier for you to see what it is that what the evidence already tells us. And that's part of kind of what we're talking about today. We're selecting one of those learning questions, and we're deep diving today into health system strengthening measurement, and that's kind of what we have here. So one of the key themes that came out, and I'm just going to run through two quick more slides, and then we go into the panel discussion today. But you'll notice that in the key themes, we realized very early that there's a strong interest in using complexity-aware methodologies, to capture the very intricate, interrelated, interactive nature of health system strengthening. And we also realize that there are over 100 different complexity aware monitoring and management frameworks out there and approaches. They're just, funders globally use them, development partners use them, and some of the more common ones discussed in the literature are things like causal link monitoring, outcomes mapping or outcomes harvesting, contribution analysis, ripple effect mapping, most significant change. All of these are recurrent in the literature. So we try to kind of make sure we capture them all and we characterize them here. So that's one thing that we saw that was very key. There's a strong interest, and you would see from the discussion that maybe there isn't as much expertise in complexity aware monitoring. So that's kind of where LHSS measurement kind of needs to catch up on. The other key theme that we discovered is that there's an increasing trend using methods such as development evaluation that engage a diverse set of stakeholders, to generate real-time evidence to both evaluate and adapt and continuously learn from complex health and social programs. So you notice that participatory methods and real-time evidence is increasing in the literature, and that's a good thing to see. On the other hand, even though there are more practical and participatory evidence-generated methods, theory-based approaches have been applied. And those theory-based approaches and the theory of change and process theories, that helps us better understand the implementation and the complexity of the implementation of health system strengthening programs. So it is being useful, and we still embrace those theory-based approaches because they kind of help us with the lens through which to see the type of change that's happening in HSS. There is context specificity of tools. Many of the tools are highly context specific. That's one other reason why there are over 100 of them, because sometimes you need to kind of tailor what exists to your situation in order to apply them. And when you do that, there's also we're kind of reducing the applicability of that tool to another kind of setting. So those are kind of things we also notice in the literature. And then finally, when we are applying these measurement approaches to better understand health system strengthening relationships and interactions, one of the themes that emerges that relevant stakeholders should be included throughout the phases, implementation, when findings are shared, just so that decision making that comes out of these processes or application of these tools can demonstrate value add and help with collaboration and gender support for the continued use of these measurement themes. So that's something else we saw in the literature, and we wanted to just highlight those things here. However, the gaps are rife too. We do there isn't a lot of practical guidance on how to apply these tools. Like I said, there are a lot of them out there, tools approaches, but there isn't a lot of literature to in the application of these tools and institutionalizing them in that sense, making it more consistent. The required resources, the expertise, the skills, and the time to actually do them, it's all limited. And I'm sure we would hear a little bit about that both in the poll and in the discussion roundtable discussion session a little later today. And there's also limited evidence, around when the non-traditional M&E type approaches are utilized. We don't have it. When should we use them? That's a constant question we continue to see, especially when there's a need. So that means there is a need to shift. We don't kind of understand what is needed to foster a shift in practice for actually applying these non-traditional approaches. We need to identify incentives, we need to secure buy-ins from partners, and we need to develop the essential capacities to do this. But there's limited evidence around when are these tools best utilized. So and then the third point here is that there is limited evidence around strategies for implementing adaptive management approaches, because these tend to increase overall management burdens. So we don't have the evidence around the strategies for doing this in a very efficient way. We know its value, but it usually comes with a lot of more costs or management burdens, and then there is global recognition of the need for more consistent, standardized approaches to evaluate the estimated impact of HSS interventions. I always say that this is an old problem. It's a lot better actually over the past couple of years. As significant work has been done on many fronts, and I'm sure some of our discussants have experience or have some experience with it or know, but there's still there is a global recognition of the need of more approaches that are standardized, like I mentioned earlier. And then finally, one of the gaps we saw as well is that is that while most theories of change actually are relating to specific health system functions, there is a gap in the tools and approaches that capture the spillover effect on the broader health system. So you'll see in many programs there might be a specific health financing or health governance or commodities or service delivery theory of change, which is described and is very clear how these how we can measure the effect of these of tweaking one or two health system functions, but there isn't enough there's a gap in the tools or approaches that capture the spillover effect of doing work in one place and how it affects the broader health system, including how it even affects other non-health sectors like education or agriculture, or trade and development, those types of things. So we kind of need some of that as well, and we found that there's a gap in the literature for characterizing that. So those are some of the themes and the gaps, and we want to just kind of turn it into the poll now. I know I've gone over a couple of strong or meaty pieces, and like I said, these are just a summary of our high-level findings. We have a two-pager on the site. You could access it and read it, but we want to hear from you in our poll, and we're going to get it popped into the chat. There's a poll link that is going to come into the chat, so click on that link, and there are a couple of questions we want you to think about, and we want your impressions about, if you don't mind. So this is the interactive participatory part of this webinar. So please, if you are mobile, do not take your hands off the steering wheel, and we would read out the questions. And the poll would launch directly on your screen through the WebEx application. If you're not seeing it, just click the icon with three boxes at the bottom right of your screen, and then you activate the poll, slide over the poll platform, and then you can vote there. What I'm going to do is that I'm going to very quickly, oh yeah, see, it's popped up. If you can see my screen, it's popped up here, and you can see the question. So what I wanted to do here, real quick, is that there are yes no questions, and this is the first question. Do you agree with the following gaps in the literature, like I just presented? Just answer yes no to the responses there, and then you can scroll down. So there are five quick questions, and I'm going to allow for some time for you to do this. Do you agree with the following gaps in the literature? If you say yes, just click yes. If you don't think that the gaps we talked about are these gaps and these bullet points, then just say no. And then, but if you're not sure, there's always a maybe, and there might be a couple of maybes, and we hope to explore that in the discussion. So the first one is limited literature of practical guidance of how to apply CAM tools and approaches. Like I said, I think there is that. I may be biased, but that's the way it is. Then the second one is limited evidence around when non-traditional monitoring and evaluation approaches are best utilized. I think that there might be more, there's more evidence coming up, but it is comparatively to a couple of other sectors, it is limited. And the third bullet point here, the third question is that there is limited evidence around strategies for implementing adaptive management approaches that do not increase overall management burdens. Yes, that I think is yes. I hope I'm not swaying your choices. Feel free to vote as you think. We just want to get a sense of what you all 181 people feel about this. Thank you. Wow, that's an impressive number. And then the fourth one here is that there's lack of consistent and standardized approaches to evaluate the estimated impact of HSS interventions. What do you think? What do you think? And then finally, gaps in tools and approaches that that capture theory of change, but spillover effects are not as well characterized. So, what do you think about that? And once you finish, you just send. There's a send button at the bottom, and if you think differently about a response, you can always edit your response. But we hope not. From my screen, I can see that 74 or 76 attendees are completing the poll out of 100, nearly 180 participants. So I'm just going to give it 1 or 2 more minutes. Sorry for everyone to join in and do this. The number is increasing now to close to 85. So thank you so much for this. And then I'm going to wait for about 20-30 seconds while you read and complete. Be playing the Jeopardy song now, if you have that cue music. Okay. Yeah, so these are kind of tough, deep questions, but you would see from the evidence gap, yes, from the evidence gap map that there is rife literature, and I'm really looking forward to the roundtable discussion. All right, so I think we've the 30-second song has finished playing in my head. Thank you. The voting has closed. We're going to see the survey results real quick. And that will be popping up on the screen anytime now. So the survey is currently locked at 92 entries. That is great. That is a great number. So whenever the results are ready, Mariam, we can show them up.
Yeah, no problem. 1 second.
Yes, thank you very much. And we have just 2 more quick questions. The other 2 questions are not as long as this, so that wouldn't take us as much time, but I'm sure we will be able to cover it.
All right, and then my screen should be sharing in just a second. So,
Yes.
what's up?
I don't think I need to stop. It just kicks me
No,
out.
you're okay. Yeah.
Yeah.
There we go.
All right.
Let's
Great.
see.
That is it. All right. So if you see from here, there is a kind of a clear indication that most people think yes to the first question. A couple of maybes. I expected that. So thank you so much. We're going to explore some of the maybes. And then the next question, please. Yep, it's about 70%. So there are more maybes here regarding the question about when non-traditional M&E approaches for HSS interventions are best utilized. I'm not surprised at all. Um, so the third question, that there's even more maybes here. So it looks like adaptive management approaches, the strategies about when, about overall about these approaches that do not increase overall management burdens. It looks like there are more maybes here. So it looks like the field is more mixed here. There might be more evidence, so that's fine. The next next question. Okay, this takes us back up. So more people here say yes to and agreeing that they aren't standardized approaches, to evaluate the estimated impact. So the age-old problem is still a lingering one. Okay, and then the last question, gaps in tools, that's also high as well. Spillover effects, so spillover type tools, it is something that we need to kind of invest in. All right, so this is very good. So thank you all so much for this. I'm just going to go back quickly. There is the second question is going to pop up as well on your screen. So do we need to click on it again
Nope,
to
it
see the
should.
second
I'm just going to
question?
go ahead and launch it, and it
And
should come
yeah,
up for everyone again.
great. So yeah, exactly. The second question has launched on the screen. I have that right here now. And so this is very quickly. What is the biggest challenge you face with health system strengthening measurement in your work? I'm hoping that a lot of people on the line here have faced one or two challenges, but what challenge have you faced? Let's see. Um, One, two, just if remember these are you don't have to click just one. I think you could click actually yes, you could click just one. We want the biggest challenge you faced so that we can have an idea of what's out there. So click one, don't overthink it. And if you answered other, please type in very quickly your answer. And in this one, I'm not gonna waste too much time. I see that we just have 30 or so folks that have voted going up. So please let's click on the link and vote. I'm gonna play the Jeopardy music again in my head, making sure that everybody we have enough time. Um, all right, there are a couple of folks that say they are not seeing the poll. Do we need to click on the three dots, Miriam?
Yeah, so it's possible that if your apps aren't launched within the platform, you may just not be seeing it. So if you see those three squares with a plus sign at the bottom of your screen, the bottom right, towards the chat as well as the participants icons, if you click on that, you should see an option for an app called Slido, Slido. And if you click on that, it will tell WebEx, go
Yeah,
ahead and
to
launch
jump
it,
in. Good.
and then it should pop up on your screen for any reason. If anything, Pyongyang, if people are having issues and they want to type it in the chat just so you can continue to get those responses to the question, that's something we can do as well.
Yeah, that's great. And these other questions are pretty much short, so you could always just type in your thoughts about it. Biggest challenge, so feel free to just type it in. One of the other things I wanted to say real quick is that the time has ended for this question, so we're going to go to the next one. Yep. So why don't we? Yep, let's end that and see the quick results here. This wouldn't take us much time because it's a shorter question. And then the other thing that I wanted to say real quick here is this isn't Maram. Yes, this yeah. Oh, so there's a tie from the first two. The biggest challenge that is faced in identifying context appropriate measurement tools and approaches, that is probably the highest. It's tied with limited resources and time, not unexpected. Securing buy-in as well from key stakeholders, and then using or disseminating results and the other, I believe, filled out some of the two. So let's go to the last question real quick. I'm just looking at the time down here. And the last question here is about how would you use this tool? How would you possibly use this tool to inform your work in health system strengthening measurement? So if you feel like, oh, this is a great tool, I think I might use it for this purpose or the other, please go ahead and let us know. So this has popped up as well. Um, and in this particular case, we want to know your top, what you think, what your top, I mean, of course, if we think that you want to use it for several reasons, but just your top reason so that we can have a sense of which one will be, um, will want to use. So to learn more about existing tools, to find country specific examples, and to submit additional literature or measurement that is not currently there, we hope that you will choose one of the three, and then we can see the responses right away. How would you use the EGM tool to inform your work in health system strengthening measurement? And in about 10 or so seconds, this is a very short one, so we can end it real quick. I can see the voting numbers going up. Yep. All right, great. So let's see what does it look like? What's the result like? Slido. Oh yeah, all right. To find country context-specific examples, that is winning by far. Yeah, so it's still clear that we want to see examples, context-specific examples of HSS measurement tools and approaches, and also to learn more about existing tools. That's great. We're hoping that, yep, and then someone sent in the chat to see how practical to use this from other examples. That's kind of similar to the second one. And then we are hoping that later on, most people would have, because we do not think that the evidence we've pulled together is the universe of what's there. So we're hoping that there might be more later. So we'll talk a little bit more about that. All right. So this here ends the poll session, and we're going to dive in to the roundtable discussion, and this is where I introduce in more detail the discussants the discussants in the panel that we have. So very quickly, and as we do that, as I introduce you, fellow discussants, feel free to turn on your camera so that we can meet you. We're going to start with Jessica Scherer. She is the monitoring, evaluation, and learning lead for the Momentum Routine Immunization Transformation and Equity program, and she works with PATH. Hi, Jessica. Good to see you. Good to see you there. The next discussant we have on the panel is Mr. Kabir Sheikh. He is the policy advisor for the WHO's Alliance for Health Policy and Systems Research. Good to see you, Kabir. I know you've been traveling, but thanks for joining us today. And then Sohel Saikat, he is the lead and technical specialist, health systems resilience and essential public health functions. The resilience group at WHO headquarters in Geneva. He's also here. Nice to see you, Sohel. Justus Uzim, he's a male specialist and at the USAID Nigeria Mission Office of Health, Population and Nutrition. He's here with a big M&E male cap on. Nice to see you. Nice to see you, Justus. And so that's who we have on our panel. We do have a couple of other folks here. Rachel as well. Feel free to chime in anytime. And Sakif as well from WHO. Feel free to chime in anytime. So these are the panels. These are the discussants that we have, and I'm going to dive in real quick to the questions that we have. My first question is to the both of you, Kabir and Jessica. So if you've noticed from the deep dive and from the chat and from poll questions, understanding and measuring the complexities of the impact of health system strengthening efforts is an old problem. And from the poll, we can see that there is still appetite for how to make that connection. Health system strengthening interventions, measuring the effect and the impact on health outcomes is an old problem. So, in your own experience, what are the top two challenges that you would say health system strengthening practitioners currently face in their attempts to kind of measure the impact of their work? How do you think a tool like the EGM will help with that? What are your thoughts about that? So Kabir, you could jump in, and then Jessica.
Sure. Thanks, Ipenyong, and very nice to be on the panel with all these fantastic colleagues, some of whom I've had good fortune to meet and work with in the past. Okay, so it's a big question. I mean, I think it's what we underestimate sometimes is the depth of this field, M&E and learning, and I think it's really credit to Rachel and her team and to USAID and to everybody who's been part of this project to really, get into more depth to thinking about not just the tools and measurements that we have, but actually understanding what we are trying to achieve through measurement and learning. And I think that's really the crux here. And I'd like to kind of touch on that a little bit. I'll try to keep myself short, although I could talk all day about this. But it's so I think so understanding and measuring the complexity. I mean, first is unpacking the rationale for why we want to understand and measure, right? I mean, and there's obviously a big accountability rationale, often an external accountability rationale that drives our desire to understand what's going on, how our investments are actually getting returns and so forth. And then I think there's also the learning one, which again, big credit to USAID for bringing it front and center. But many other agencies are also really foregrounding the learning focus. And so I think here I'm going to just beat our own drum a little bit, because at the Alliance, we've been thinking about this for a while, for the last 4 years. And we've developed a program of work on learning health systems. And one of our first steps was to really try and unpack the different components and elements of learning. I think it's also one of those terms that's used very broadly and people mean different things by it. So we use learning organization theory to unpack that. And the first thing to understand is that learning is multifaceted. So there's, different types of learning that happen. There's the learning through information that we often associate, but then with that's a common association. But there's also learning by doing, and learning through deliberative processes, like when we actually come together and discuss the findings of M&E. That adds a lot more value beyond the actual component beyond the content of the information. And then the second thing, of course, is who learns. Is crucial. So I mean, information is power, knowledge is power, and I think very often when we concentrate who we think about who wants to learn, and it's the people with the most power who want to learn, because then they can exert that influence over the rest of the system. Whereas actually the people who are most likely to make change are often at the lower rounds of the health system. So I think we should be moving, if our objective really is to move the whole system along with the learning agenda, then we should be concentrating our efforts on engaging the people who are actually involved in bringing about change in health systems, and target them as the recipients of, not just the recipients, but the protagonists of learning. So that's sort of a slightly long-winded way of getting to my main point, which was about unpacking. I think single and double loop, I'm going to touch on that. That's very important, because I think a lot of external accountability-driven learning tends to be single loop, which is single loop learning signifies making improvements as we go along, which is very important. We must improve what we do, but it's incremental. Whereas double loop learning is more about really challenging what we're doing. Should we really be doing it? Should we be rethinking our policies and so forth? And there's not a lot of incentives for double loop type of learning. A lot of the incentives that we create through M&E structures tend to actually prevent people from doing double loop learning. Like, we want to show good results, we don't show failures, we don't. So there's perverse incentives there. And then I think also think more broadly about the outcomes of learning. So there's improvements, of course, as we mentioned, but also adaptation and innovation. I think that has to be another very important aspect of learning. And ultimately, I think self-reliance is another poorly understood outcome of learning. That if it's a system learns for itself, then it's less likely to be reliant on external forces, sometimes which are politically imbalanced for that learning. So in short, the biggest I think challenge, one of the biggest challenges, is trying to understand and unpack what the rationale for learning is. And I think the second, which I'll try and keep very short, is to try and recognize what health system strengthening is. It's not just a tool to achieve health outcomes, which it is, no doubt. It is an instrument to achieve better health outcomes, but it's also a fundamental social development function. So there are health system strengthening is about creating social institutions that perform a range of functions, which ultimately get together to improve health outcomes, but also serve other functions. There's financial protection, there's fundamental social, there's a social character of those institutions that needs to be protected and understood. So, and those, when we strengthen health systems, it doesn't automatically lead, it doesn't immediately show in the short term necessarily lead to better health outcomes. So it's really about routinizing and institutionalizing a lot of processes that, and creating institutions that promote health and protect and prevent emergencies and so forth as well. So there's two parts to that. I think the learning part, and then there's the hardware parts, which are all setting up all the resources and the institutions and so forth. Both should be given importance, as they are. But the way in which, so I think we need to recognize better that this is not just a tool towards getting there. And Rachel already alluded to that in her talk. It has its own logic. Health system strengthening has its own logic and own rationale, which is about social development. And that's why I think it's also useful to think about establishing independent parameters of health system strengthening, which I think there have been various efforts to do that. And I think many of them have been, like in the past, sometimes a little excessively focused on indicators, which didn't necessarily, fly that well because there was like this huge long list of indicators. So there's a very nice recent paper by Bertone and colleagues from the Institute of Global Health and Development in Scotland. And they've they talk about attributes. So I think health systems, the attributes of health system strengthening, there are some critical attributes, clearly resilience, learning, responsiveness, accountability, and then they unpack the different types of what is required in order to achieve those attributes. So I think that's a useful way of looking at HSS. And this tool is really helpful actually, because it creates that sort of allows us to look at all these different facets. It's eclectic in the different disciplines and the different approaches that it uses. It's complexity aware. And I like the fact that it now refers quite prominently to theory-driven evaluation, because there's a whole thread of realist evaluation, which actually the world has almost forgotten. There was a huge fashion for it 10 years ago, but I really do think that some of those ideas around linking pathways through context, mechanisms, and outcomes is extremely important, and we've forgotten about that.
Yeah.
So let's bring that back.
Yeah.
More to say, but I'll stop.
Yeah. I was in my mind. I was like, "Gosh, why did I do that?" I asked Kabir such an unfair question and gave him 2 minutes. It is unfair of me. But Jessica, I'm hoping you would. You touched on a couple of things there, Kabir, and I'm going to come back to that later. But Jessica, do you have any thoughts? I mean, Kabir has covered
Sure.
such a lot. I'm like, whoa. Go ahead, please.
Yeah. No, thanks, Kabir, and hi to everyone. It's great to be on the panel as well. So I think when I was thinking about this question also, and Kabir touched on a lot of this, I thought the two main challenges are what to measure and how to measure this, right? And Kabir, you just touched on a few different approaches and measurement methods there. And I think the gap map, the evidence gap map, is fantastic in showing us some of these measurement approaches for complexity aware measurement, for measuring the interdependencies of dynamic and complex interventions, which are implemented in very complex systems. So we're starting to get there on the how. We have a number of methods now in our toolkit that can help us understand not just how an intervention achieves maybe a single health systems outcome or health systems building block, but how it actually changes the entire dynamic of the system and achieves various systems outcomes. So the how, I think we're getting there. I think the what now for evaluators is one of the most challenging things to measure when it comes to health system strengthening interventions. We don't necessarily have a standardized set of indicators or outcomes or impacts that we're looking at. And this is also because there is, again, so much complexity and so much variability in all of the processes that are happening when we implement a health system strengthening intervention. And so as an evaluator, I think the what remains the bigger challenge. And it'd be great to maybe see more of this in the gap map in terms of the measurement, the what of the measurement. Thanks.
Yep, that's great. That's great. And we actually did see that you have you kind of have rolled on some of the same concepts, how and what to measure. And we're going to kind of explore some of the audience thoughts on this. And I can see the chat's already kind of blowing up with a few inputs there. It just keeps popping up on my screen. But we're going to get back to the chat real soon, audience. A little patience. Thank you. Thank you so much. I wanted to turn now very quickly to Sohel, if you don't mind. There is a question here, which kind of has to do with some of the resilience. And if you notice, when we talked about attributes, we did mention we kind of mentioned the issue here about resilience being one of those attributes. Kabir kind of touched upon it. So I just wanted to know your thoughts about that. Same question as well, but what would you, how would you look at it, Sohel? There is a sorry, give me a second. I just wanted to take a quick drink of water here. Yeah, all right. So the quick one here has to kind of do with, why would you think that this health systems and integrated approach to monitoring, how is that required for building resilience in the 21st century public health challenge? Like, what is, given the complexity, the diversity and fragmentation of the current approaches we have, do you think there should be a need for a unified approach, especially with respect to your lenses on resilience? What are your thoughts about that?
So thanks everyone, and congrats to USAID and colleagues here, because many of the work that we are doing, I think, as my colleagues mentioned, I think is also supported by USAID on the shared agenda on resilience. I think we need to go back to some very, very basics here, that we are just coming out of COVID-19, but there is a significant backlog of services in countries in all income groups. At the same time, there are diverse stressors and demand when the health systems is under-resourced in most of the fundamental, whether supply chain, whether it's the information system. So this is the context that we are operating. And then there is also economic stressor, and very, very profound. But if we look at the investment from global to country level is very, very fragmented. I think there is investment focusing, for example, just on NCD, on communicable disease, and the investment focusing on global health security agenda. But there is not that much of alignment in some of this investment. I think that is proliferating more fragmentation within the institutions, as well as the way country health systems is being developed. I think that also contributing the way we wanted to look at the assessment and monitoring. At the same time, if you look at this planning context, for example, in most of the country, there is a health sector strategic development plan, which is the traditional health sector development. But if you look at from a security side, there is a national action plan for health security. There is an AMR action plan. So none of them are properly twined in terms of developing the baseline capacities. So the monitoring is also reflect the way funding flows, the way the planning and budgeting are in place at country level. So I think we cannot fix the unified approach to monitoring, but unless we can fix some of the fragmentation that are exist in policy planning, budgeting, and investment. But from a WHO point of view, what right now we are trying to achieve is two important activity that we are forcing now. One, developing a dedicated set of indicators that would allow countries to measure health systems resilience. And we are looking at what is required in each of the building blocks, but at the same time, we are also looking at what multi-sectoral actions should needed to be institutionalized, because we all know that multi-sectoral actions always there if there is a pandemic like COVID-19. But in normalcy between emergencies, the multi-sectorial whole of society, whole of government approach is often absent. So we are trying to look at it in an integrated way. The second piece we are trying from WHO, I think, is also part of the GPW 13 revision that we had done, and the US government is one of the major contributors and partners to that work. And GPW upcoming 14, as well as the action results group that we are just embarking from WHO, is how we can consider the UHC health security and healthier population as a one interdependent agenda for country support. So the one technical product that we are in a final stage this biennium is how we can guide countries on integrated planning, so that yes, in the short term future, it may be that some of the vertical planning can remain there, but how we can better base some of this planning so that they can proliferate benefit on a strengthening baseline health sector development. And in moving forward, we cannot expect a health systems for NCD, a health systems for health security, a health systems for COVID-19. We need to challenge that. It can be painful in a way that we cannot inform the taxpayers about some short-term, low-hanging fruit that we are often used to. We need to maintain some longer-term vision, how we can foster integrated health systems and strengthening. And USAID and many of you are part of this shared vision to develop self-reliance in the health systems. Thank you. Back to you.
Thanks so much, Sohel. I do appreciate that. I think what you did say is it reminds me of a popular saying, "Follow the money," right? If the money is vertical, if the money is streamlined that way, then of course even the mail processes tend to follow the money and get to be streamlined. So you stress the importance of planning it in an integrated way and driving it that way, and I think that's an important piece. I want to turn to you, Justice, if you don't mind. There is a question that has been burning, and this is a more practical one here. You've had a chance to take a quick look at the gap map, the evidence gap map findings on this learning question. What is your impression on the literature gaps summarized in the one pager and that we went through in the poll? Do you agree that these are the gaps that they are, or do you think there's something we are possibly missing, an obvious gap that we are not touching within this evidence gap map?
Yeah, thanks, Epanyong, and thanks to other colleagues. Really happy to be here to share. Yes, I think it's really an interesting topic, and I did look at the two-pager that was sent, and also, like you said, reflecting on the responses from the poll is actually really interesting. And I do realize or recognize the fact that, of course, health systems strength in measurement is highly context specific. And one of the things I did when I looked at that gap was to basically do a deep dive, because I work in Nigeria. And then I said, okay, let's kind of do a deep dive, look at the filters, look at the data, evidence available for Nigeria. And then you see, it just came up with very few records. So while there may be a number of data or information there, I mean, like 163 records based on what's currently there, you would see that for Nigeria, it's just three records, so it does lend the fact that, yes, while there's general gap in a couple of areas, some other areas still have a need to actually have more evidence and information sharing. So I do recognize that fact. And then the other part is to look at the fact that yeah, while we look at, I totally agree with most of the, I mean, basically all the points raised in terms of the literature gaps and all that. And then noting that for low and middle income countries that have varied situational circumstances surrounding the health systems space, that would maybe something to begin to look at gray literature, for example. So gray literature, like for example in Nigeria, you would see that we have some level of information, especially captured in official government reports
Mm,
and documents from government surveys that have gone through very rigorous processes of vetting and peer reviews and
mhm,
consultations at national level or subnational level. They also have some level of information that could actually be very helpful and useful, that provide information in terms of um, either the processes, methods for conducting some sort of assessments for health systems, and also providing the data from those. So there are quite a number of them. You have surveys, annual reviews of the health sector, reports that are national publications from the government, but don't make it into what you consider as the normal literature. So I think it would be good to expand the platform to go beyond the
mhm.
traditional literature and have those gray literature. Second other point I noted is the fact that I think for the non-traditional as methods of assessing health systems, there's still need to have evidence or literature that show things around the use of that of the data, the processes, and all that. We're actually struggling with a lot with the fact that we though don't have the richness of all the data that we need for health system strengthening. The little data we have, I think we still need to optimize the use of that data. So I think there's needs to be, and I see that we also still don't have a lot of literature that show things around talking about how to use the findings that come out from these non-traditional methods. I think that's something that would be important. So things that look at behavioral dimensions that kind of either barriers or enablers to use of these non-traditional methods would really be helpful. I recognize that you have literature on general data use, but then things that speak specifically to these non-traditional methods would really be helpful. Noting the fact that there is skills sort of capacity gaps in terms of understanding these methods and then how they are used. So I think that's one area also that potentially could be of importance. I know you've mentioned a couple of other things that are really, really important that have shown up as gaps. Of course, just to also highlight like issues of costing and the variability of resources, what gives you that confidence to use this method over the other method in terms of the cost. Speaking for Nigeria, Nigeria is a very diverse country with very nuanced settings as you move from national to the different states. So that context specificity is what would be nice to have a lot evidence. But it's good that the platform actually gives an opportunity for people to upload
Yes.
documents and take in a lot more information. So I think a lot needs to go into more of um,
Efforts to push that.
efforts to
Yeah.
push that in and then get
Mhm.
people at like lower middle income countries to look at maybe grey literature and how they can upload those. Yeah. Thank you.
Oh gosh, I appreciate that, Justice. And we had exactly that thought in mind when we thought about the crowdsourcing function of this tool. We're hoping that we can make that upload and that contributory process more streamlined. But thanks for these points. You did talk about optimizing the use of data that comes out of using these non-traditional methods, and also making sure that there's more evidence there on, oh, we use this method. This is not just how the method worked for us, but this is the outcome of the methods and the change that happened as a result of it. That way, it gives potential users more confidence in more going ahead to using the methods. I think that's a great piece that you bring out there. All right. So there are a couple of questions we want to pose to the audience, and I'm going to come back to us all on the roundtable now because there are questions from the audience to you. But I want to pose a question to the audience in the next minute because I do understand that we're at the top of the hour. We have another, 11, 12 minutes left here, but folks might have just had an hour reserved. I just want to ask the audience a question before we, the pelter off. There's a question that came up in the chat, and Kabir did mention something here about the challenges, the rationale for understanding measurements, like the who of learning. Who is learning? Are we targeting the right people? Are we making sure that we are aligning the who of learning to the folks that will make the change? So audience, what are your thoughts about this? Do you agree with some of those challenges that Kabir talks about? And if so, feel free to unmute yourself and chime in or just type into the chat. If you want to use a hand raise feature, go ahead, but just unmute and chime in. This is the time where you get to, because I know that there's a lot of you that have a lot to say. Anyone? Anyone real quick? Let me pop up my chat real quick. Do you agree with some of those challenges? Why we want to understand measuring who is learning? If there are no bold takers, I would. Okay, if there are no bold takers, I would turn it around the other way. Sohail, there's a question for you in the chat for you. When will this process of coming up with a harmonized HSS framework start? Like, is there going to be a consultative process? Are people going to be asked be involved in getting that harmonized HSS framework per se that you just mentioned when you spoke? You have about a minute or so to respond.
No, thanks a lot. I think the purpose of this dedicated, unified set of health systems indicators, so it is in an advanced stage. It will go out or within WHO consultations as well as consultations with the key partners like USAID, FCDU. So it's going to happen, I think, in the next couple of weeks' time. But the fundamentals here, colleagues, is still what I am saying is that. So the purpose of this indicators package is in a thematic way, two folds. One, how we can galvanize the thinking and investment to support baseline health systems capacity development. That is core. For example, if we do not have a proper health workforce, if there is no resilient information system, if there is no supply chain, if there is no cold storage, whatever we are saying is not going to work in a country context. The second one is this a public health orientations, I think, which has been key, which has been overlooked. So in this indicators package, we are underpinning all the indicators set with that essential public health functions underpinning, so that there are indicators to look at the cross systems issues. For example, how health workforce is connected between urban and rural context. How the information system, is it just in the capital or is it also be placed in primary care level? For example, if we do not have a capacity in primary care level, that means whatever capacity you want, for example, for international health regulations or achieving global health security agenda, is going to be a flawed one, because the contact tracing, surveillance, diagnostic, all are going to be delayed. There are going to be more pressure on secondary and tertiary care. Similarly, 75% plus diseases are coming from animal reservoir. So if we do not have an indicator how the interoperability in terms of resource, in terms of assets between veterinary sector, public health, and healthcare service delivery, we cannot expect a resilient health system. It's going to be an expensive one, like the COVID. COVID is an expensive one. So we need to challenge that type of culture and investment, how we can come up with a smart way to look at the system, how we can come up with a lean settlement for a health system that can serve multiple purposes. So that is the core of this indicators package.
Yeah, right.
Hopefully, I think there is still some fundamental works we need to do, how we can twine this indicators package with the routine health information system.
I see.
So that is
And
very key.
all
At
that
the
is
same time, there's the IDSR and other types of indicators. So we need to come up with some types of integration. Otherwise, we cannot fix the situation. Over to
Yeah,
you.
we're gonna be looking to the WHO for more on that. I appreciate the fact that you said it's at an advanced stage. So we're looking for that. You're right. It's very the practical issues, connections to DHIS to SARAS, the underground health information systems is key. Otherwise, this is gonna remain as one of those things that we just have a one-off, different matrices that come up and go. There is a question. There's a contribution in the chat, but before that, I see the time. Jessica, in 30 seconds. Are there any successes or of such tools being applied? You know, like we said, there are a ton of them out there. But are there any specific successful examples that you know about? Because they came up in the poll that people want more evidence on how it's used. So anyone you want to share about?
Yeah, sure. Great question. And I think there are a number of examples. I hesitate to say successes because every time we put together a package of these complexity aware measurement approaches, we're learning, right? And this is to the whole point. There is no standardized protocol. It's not like you're implementing an RCT where you have a very, very standardized protocol for how you do this. So the way that my team often thinks about this, and we're doing this right now in our Momentum project, is we think about it as a menu of options. And for the questions we're trying to answer in terms of the effectiveness or impact of health system strengthening interventions, how do you pull in these different options, approaches, tools from your menu and apply them together in a way that really helps you to understand whether, why, and how these interventions work to achieve various outcomes. So some of the principles that we always apply are theory-based evaluation. And I'll use the example right now. We're evaluating large-scale health information systems transformations that happen for COVID-19 vaccination. And so we bring in policy theory, organizational development theory, behavior change theory to really, first of all, help us understand how we might go about evaluating that big health information system intervention. And then we also always apply process evaluation, and ideally prospectively. And so this is one of the notes for funders. Ideally, you're there from the start, observing how things are changing. But to really understand how things are changing, we almost always use a method called causal link monitoring. It's something I love. It's a complexity aware monitoring method. It helps you really detail out every causal chain you expect from your interventions theory of change. You start to understand all of the assumptions, all of the context, getting back to realist evaluation, as Kabir had mentioned earlier. But then in this case of the health information systems changes during COVID vaccination, we have no counterfactual. In the case of most countries, this was a new national health information system that was introduced. So how do you measure the outcomes of that in a way that is somewhat systematic and gives you kind of some sense of the estimate of impact when you have nothing to compare it to because it was a nationally introduced reform? And so we are using methods like outcome harvesting and most significant change to get really creative. So we're kind of telling this whole story through this process. And then at the end of it, trying to see what did change and what can we link back to those health system strengthening interventions. So it takes a lot of methods, but it's certainly possible. And I think we have some great examples from the literature. So excited to see more of those come up. Thanks.
Great. Thanks so much, Jessica. I think that's a great point. And I appreciate the example from the causal link monitoring realist in COVID situation. I saw a +1 here from Justice, so I appreciate you chiming in real quick. A couple of comments in the chat, and I want to just read through that real quick and then invite Rachel for one or two quick closing remarks because we're heading up to the time reserved for this. Mariah Boyd Buffer did say something here that the point about being no standard set of indicators feels like it's the greatest hurdle, due to the complexity of HSS. So the how to measure is better understood than the what to measure, as Rachel nicely pointed out. So she wants to kind of hear about what tools or frameworks people have found most helpful in practice. And I think this is a very big question. And that is kind of one of the things I want to ask the discussants here. Anyone comes to mind real quick? Jessica, you just talked about something now, but Justice, any other quick thoughts? Oh, I've tried to use this before and this has been kind of helpful? Anybody just jump in real quick, Justus, Jessica, Kabir, any tools or frameworks people have found most helpful in practice? Any takers? All right, Jessica. Oh, Rachel, you want to say something?
If you were
Yeah.
going to go say something, go first.
Oh, no, I just was asking if anybody else
I was
wanted to
just
say
going to say,
something.
since we're at time, I think that's actually a very substantial follow-up question, which
Yep.
might serve us to kind of tackle in
Think
a
about.
separate piece, and with perhaps some follow-ups. There's so many requests for good resources in the chat, and so we're consolidating those to share back out with attendees. But I think this is also a part of what we can try to consolidate, is where
Yep.
we really do have good examples, or kind of folks go to tools and approaches. We can try to consolidate. I also think that is something that also came up in the polls, right, as one of the key gaps, and is something that is a broader need for us to try to tackle, and figure out how best to organize and manage that knowledge and information. So I actually think that is like a nice segue perhaps into closing, because as unsatisfactory as it may be to not fully answer that question, I actually think highlighting that question as one of the key gaps and priorities coming out of today is part of what our objectives were, which is to hear from all of you about what is most helpful to facilitate this practice going forward. And that to me seems like a key piece that we've heard now in various ways repeatedly throughout today. So what do you think about that? Shall we close on that note?
Yeah.
Okay.
Yeah, I think so. Yep. I think that's a great note. That's a great piece.
I mean,
Go
and
ahead,
in general, I'll
Rachel.
just say thanks from my end for everyone. I don't want to keep folks longer. I think I was reflecting that we could probably have an entire deep dive day on this with the many folks who are on the line, and there's so many facets of what to talk through, but some of the comments have been really, really valuable. The polling has been valuable. Hearing from our discussants has been really valuable in helping myself and hopefully others in identifying some of the key needs for moving our work forward. And also maybe on a more inspiring note, hearing how much work is happening. Just even in the years that we've been talking about this, I think we have seen so much progress and transition in the way that we are able to even have this conversation with some shared terminology and agreement about what our goals are here and what else we need to do our work better. And I find that actually really encouraging, since it was for a while quite challenging to even discuss some of these topics concretely, since folks were using such different language and coming at it from such different perspectives. So I'm happy to be able to have the conversation, and happy to hear from all of you of what we need to continue to invest in and support to move forward. So just a big thanks from my end, and big thanks again to our discussants who organized themselves today with lots of important thinking, and Epinang, back to you for the final remarks.
Yeah, exactly. In the next 30 seconds, I just want to highlight some quick things. I echo Rachel's thanks. Thanks to you all for joining us. We had at the peak of this meeting over nearly 200 people. So because this is an important thing to talk about. And like Rachel said, the fact that we can actually talk about it at this stage with the same language, same terminologies we all understand is a huge advantage from 10, 15, 20 years ago. So I want to appreciate that. This is one in series of learning series that we're going to be having. The next one is on April 25th, just putting a plug in there. And it's going to be at 9 a.m. Eastern time. That has to do with climate adaptation for better health outcomes. That is part of USAID's Agency Learning and Evidence Month. So April is a packed month for them at USAID. And then two quick things. There's going to be an event evaluation. Please fill that right after this webinar ends. And then the recording will be made available to everyone that signed up. On another final note, Bruno Boucher did type in the chat to involve a lot more owners of the health system, or the more players of the health system. And we hope that in subsequent events like this, we're going to make a deliberate effort to try and invite them and pull them in so that we can get their reflections, since they're some of the decision makers. Like Kabir said, we need to kind of make sure that who is learning is part of some of these types of discussions as well, and we use it. So on that note, I realized I didn't introduce myself at all. My name is Ekpeyong Kanem. I work as a director for planning, performance, and learning on LHSS, part of Apt Associates. It's really nice to meet you all. Nice to hang out on a Wednesday morning, afternoon, evening, wherever you are. And thanks for the discussion. We would be in touch with you soon with the recording and the slides. And take it easy. Have a great day, evening, night. Bye.